Hello and welcome to this patient information video about pelvic organ prolapse. We are the Pelvic Health Physiotherapy team here in Somerset. This video will explain what a pelvic organ prolapse is and the common symptoms associated with it. It may help to watch the pelvis and pelvic floor anatomy video first. Here is the pelvis in a side-on view. You can see the base of the spine to the left of the picture and the pubic bone to the right of the picture. Inside the pelvis sits the three pelvic organs. The bladder at the front, behind the pubic bone, the vagina and uterus in the middle, and the rectum at the back. The pelvic organs are all suspended in their position by a complex network of ligaments which you cannot see on this picture. They are also held up by a very important muscle, the pelvic floor, and this runs along the bottom from the tailbone to the pubic bone. In our earlier years, these organs are securely suspended up in place by a network of ligaments. Over the course of our lives, these ligaments can stretch and lengthen, and in some cases, allow the organ to drop down into the vaginal space. The symptoms of a prolapse can include heaviness, dragging and bulging in the vagina, heaviness and aching in the lower tummy, lower back pain, difficulty maintaining tampons, bladder issues, bowel issues, and painful intercourse. These symptoms can be mild, causing little or no bother, or they can be severe, causing many problems. The symptoms may be there all the time or vary depending on the time of day, monthly cycle, and activity levels. How much the prolapse interferes with your life may relate to how much you can feel the bulge inside your vagina, or in some cases protruding outside of the vagina. Around half of women who have had a baby have a prolapse. After menopause, it affects half all women, regardless of whether they've had children or not. It is estimated that only 30 to 50% of women seek help for their problem, and that it takes, on average, 7 years for women to report their symptoms to a health professional. Once a woman is referred to us in physiotherapy, we will often do a vaginal examination to check their pelvic floor muscle. Interestingly, we have found that around 40% of women are not doing their pelvic floor exercises correctly. However, the good news is that 80% of women who do their pelvic floor exercises, based on advice from us, report an improvement in their symptoms, so the odds are in your favour. As a result, only around 20% of patients who do physiotherapy need a referral onwards to a consultant. Your pelvic floor muscle helps protect your pelvic organs from prolapsing further, especially during activities that typically make it bulge, like coughing or lifting. Learning pelvic floor exercises takes time and practice. We have created a separate pelvic floor exercise video which explains how to do this. Good bowel management is really important when dealing with incontinence or prolapse. Crucially, it is important to avoid constipation. It is recommended that you keep your stool at around type 4 on the Bristol stool chart. Too firm and you might need to strain, which may push your prolapse out further, or stress the ligaments holding up your pelvic organs. Eating plenty of fibre, such as fruit and vegetables, can help. Also, make sure you're also drinking enough fluids between 1.5 to 2 litres a day. Try to develop good toilet habits when emptying your bowels. Do not strain. Make sure you sit fully on the toilet so you can properly relax your pelvic floor. Try not to hover. Have your feet apart and raised up on a stool with your elbows or hands resting comfortably on your legs. As you bear down to go, gently blow out as if blowing bubbles and allow your tummy to bulge. Do not pull your tummy in. Some women may find it helpful to support the perineum, the area between the back passage and the vagina, when emptying their bowels. We call this splinting and it is perfectly safe to do. Some women with prolapses also experience urinary incontinence or an overactive bladder. If this is the case for you, you might find it helpful to watch our Trust's urinary incontinence videos, which can be provided by your pelvic health physiotherapist. You may find it helpful to look at your current lifestyle and consider making some changes to reduce the downward pressures through your pelvis. This might apply to things like housework, your job, looking after children, and doing exercise or sport. This is particularly important if these activities make your symptoms worse. Your pelvic health physiotherapist can help you to work out how to do this. Try low-impact exercise instead, such as modified aerobics, cycling, a cross-trainer, fast walking, Pilates or swimming. We know that if you are overweight, this can put more pressure on your prolapse. Therefore, it might be worth considering weight loss to help manage your symptoms. We also know that some lung conditions, particularly those that cause a lot of coughing, can aggravate a prolapse. Therefore, looking after your condition by following the medical advice that you've been given is important for your pelvic health too. Similarly, if you smoke, please contact the free smoking cessation service for help on giving up. We recommend moisturising your vulva daily with a basic emollient cream or a specialist vaginal moisturiser. A course of vaginal estrogen, such as an estrogen pessary, which is a small tablet that is inserted into the vagina, may help with vaginal dryness. If you wish to try this, speak to your GP. Some women with a prolapse benefit from using a silicone pessary, such as a ring inserted into their vagina to help support their prolapse. There are several types of pessaries, and it may take several attempts to find the right one for you. Some GPs can fit you with a pessary. If your surgery does not have a GP who can do this, they may be able to refer you to a gynecologist. Once correctly fitted, many women say that they are unaware of the pessary. Pessaries can be used for all types of prolapse, but do not work for everyone and may not improve your symptoms or level of prolapse. Commonly, women notice an increase in vaginal discharge when using a pessary, which may be bothersome. If you do wish to try a pessary, please speak to your GP or gynecologist. Thank you for watching this information video about prolapses. If you have any difficulty following the advice in this video, or if you have any questions, please contact your pelvic health physiotherapist. Please also watch our Red Flags in Pelvic Health video to check any symptoms that need reporting to your GP.